Hi, I'm Dr. Mike Milligan. I'm here with Tom Blue, the Executive Director of the American Academy of Private Physicians. Tom, thank you so much for being with us.
It's a pleasure.
Now, you're out of Richmond, Virginia. You've been around several years.
Right.
And we're here at the American Academy for Oral Systemic Health, one of their founding meetings. And there's a collaboration with this group between dentists and physicians.
That's right.
Because the mouth and the body are all intertwined.
Correct.
And so your academy is one that realizes that.
That's right.
And you've got hundreds of members and physician members.
Mm-hmm.
And many of your members take the Bale-Deneen program,
Mm-hmm.
which shows them this relationship between the mouth and the body.
Right.
Why don't you expand on that a little bit?
Well, among private physicians who are called upon by patients who are investing privately for a differentiated and arguably better model for receiving healthcare services.
Right.
They are constantly attempting to push the envelope of current clinical understanding to deliver the best possible preventive care to patients.
Right.
And if you're in the prevention business, cardiovascular disease is a great place to start because that's the thing that kills most people.
That's right. Heart attack and stroke kill what percent of the
more
people?
than half the population.
More than half.
And
it's more than half.
It's a tragic type of a scenario because for half of that population they discover they have disease by dropping dead.
Right.
And so it lingers quietly in people until one day it surfaces often as a lethal event.
But we can diagnose that way earlier and then prevent a lot of that.
That's exactly right. So what they learned from the Bale-Deneen program is instead of approaching this form of prevention by attacking and looking for risks and risk factors, they are literally searching for disease at the earliest stages and treating and reversing disease.
Right.
And it becomes a very, very powerful platform to build a practice on top of. And what it happens to do, and the reason that that we're excited to be here, is that the science has given rise to and created, frankly, a necessity for a collaboration with the dental profession.
Right. There's just no question that a lot of the dental infection affects the rest of the body, and there has to be a collaboration there.
That's exactly right. And it's what's really exciting is that technology kind of has risen to the occasion at the same time with labs like Oral DNA, that enable the dental profession to quantify and track disease in a quantitative way that speaks well to physicians. It's a lab that physicians need a partnership with a dentist to have access to, and so the technology is pushing the two together in a way that I think is really gonna become a model for collaboration in markets all over the place. That's exactly right. Yeah, it's a wonderful alignment of the stars, so to speak.
It really is.
Yeah.
So now, for a dentist to join the AAPP, talk about that just a bit.
Well, the AAPP welcomes physician members, and then we have an associate member program that we reach out to all healthcare providers with. Right. And we've seen already a wonderful reception among dentists that are oriented to oral systemic health. Right. Exactly.
Many of us have.
Yeah, and it's I think there as I am getting to know the dental industry myself, there's obviously a long-standing frustration with with the medical profession being, turning sort of a blind eye to the dental profession and not being eager collaborators. And I suspect there are a host of reasons for that, not the least of which is just the pace and chaos of primary care.
Right, just in treatment.
Exactly, exactly. But with our private physicians, these are doctors that are working at a slower pace and a more conscientious pace, and in general, much more oriented to preventive care. And there's the time to not just listen to the science, but to act on and develop the partnership with the dentists.
Right.
And we believe, or at least I believe, that that this collaboration creates a much broader audience, not just for the private physician, but for the dental practice as well. And it's a happy, really nice business synergy.
Exactly. So now, for a dentist to join a member of the AAOSH, there's a very nice fee to join.
That's right. So we've created a reciprocal relationship to try and use as a catalyst for this for this new partnership, and and dentists and their staff can join the AAPP for $50, and our members can join the AOSH for $50. And our hope is that, you know, while we have only a handful of physicians at our first event, that next year it'll be 70-30, and
we're on a growth curve like
oh,
that.
absolutely.
Both physicians and dentists. So
absolutely.
Yeah.
So it's you know, it's really I think going to be an engine of growth for both the dental practitioners of this form of prevention as well as private physicians.
Right, exactly. Now, benefits of membership: $50 a year for membership in the AAPP. A number of benefits. Why don't you tell us a little bit about what you see there?
Yeah, I mean,
the networking would be one.
Oh, no question.
The information. Go
ahead. That's certainly true. For a dentist, you know, I'd say the primary benefits would be networking with private physicians, and ideally those in their own community.
Right.
And learning to, you know, it's always nice to sort of learn to speak the language of your prospective collaborator in your own marketplace. Right. And then, of course, you know, to the extent that they, and I hope they will you know, come to our meetings that we have every quarter, you know, there's some nice education that is really complementary to what's being learned here. It's you know, it's a lot of practical application education, and you know, and then last but not least, I mean, there's always just the stream of new announcements, and many of the lab relationships that we have, I suspect, and technology relationships that we have with industry will be. Many of them actually probably will be relevant to dentists, and so you know, we think it'll be a very harmonious relationship.
We're so excited to have this affiliation. Are there any last things you'd like to tell us before we close? Well,
I mean, other than that, it's just a complete honor to be here at this inaugural event, and you know, you can absolutely sense in the energy as well as the attendance that, you know, that this is a defining moment for a very important segment of the healthcare population, and it's really fantastic to be a part of it, you know, on day one.
Exactly. Now, how do we get in touch with AAPP? How do we learn more about you and get in touch?
Well,
with
the easiest way is to go to aapp.org and simply log in. AOSH members can join right from the site, and of course you can always call us on the phone as well. But it's yeah, that'd be the easiest thing to do.
Okay. Well, thank you so much for being with us, Tom.
It's my pleasure. Thank you.
All right.